Good morning to my class. After more than 5 days, today we are meeting again. Um, Today we are going to continue with our Unit 10, the public health. Unit 10 is community participation and health. The title of the Unit 10, it is community participation and health. Then under community participation and health, we are going to study the definition of community participation and various types of community participation and principles of community participation. There are three factors we are going to study: definition, types, and principles of community participation. Before going to the subtopics, we need to know what is community participation. That is not included in subtopic, but we are going to study the major title in depth, the relationship between community participation and health. After that, we are going to study one by one. For this session, the learning objectives for this session, it is about what I'm expecting you after finishing my lecture. You should understand the meaning of community. What is community, you should understand. Then you can be able to describe the responsibilities of the community in healthcare system. The responsibilities under community, responsibilities of the community under healthcare systems, because the roles and responsibilities were defined by Alma-Ata declarations. So there are rights also given to the community, and also the responsibilities also endorsed under community under Alma-Ata declaration to the community. Then you can able to define and give rationale for community participation in health, because these things you need to take it in your heart. It's a phenomena, though it's set by Alma-Ata declarations, but as a clinician, as a clinician, you should understand the importance of community participations. You should take it from your heart. So you need to define and give rationale for community participation in health. Then the levels of community participation. There are different levels in community participations. After this, finishing the session, you are going to list the levels. Whether you are going to allow everything, or you are going to allow only limited participations, or you are take them as a beneficiary, or you are take them as a stakeholder, or you just passing the information to the community. So you are going to understand different levels of community participations after this lesson. Then you can able to describe the community involvement in health delivery system based on the principles. So these are all the learning objectives set for this lesson. Before going to see the topics, we need to understand what is community. This is the basic thing. What is community? According to Webster Dictionary, community means it's a unified body of individuals. It's a unified body of individuals. Unified body of individuals may be the blood relatives living in a particular geographical locations. Not necessarily blood relatives. You can say people who are living in a particular geographical boundary, or you can say unified body of individuals. In another way, a body of person or nations having a common history or common socio-economic political interest. For example, people who are living in the Indian community who are living in Zambia, they consider as a Indian community living in Zambia. Though they are living in Zambia, but they are Indian community because they are sharing common history, socio-economic and political interest. They are not part of Indian society, Zambian society, but they are part of Indian society because of their common history, socio-economic and political interest. It is not interest within Zambian society. For example, the Bemba community, or you can say Losi, or you can say any other tribal group. They consider as a according to their tribal identity, they consider as a community. So the meaning behind here, they should have a common interest. They should have a either common history or common interest, common socioeconomic background, or political interest. They consider as a community. Or you can say a group of people with a common characteristics. A group of people with a common characteristics. For example, farming community. Those who are involved in farming, they have certain common characteristics. They consider as a group. Farming community, industrial community, you can say children's community, youth community, you can say this way. A group of people with the common characteristics or interest living together within a larger society, a community of retired, for example, retired persons. So a group of people with a common characteristics or interest living together is considered as a community within a major community or larger society. So I hope you understand what is community. This community, you can able to define them based on the geographical region, or based on the hamlet, or based on the interest, based on the identity, based on the history, based on the common socioeconomic background. But the point here, they should connected with some levels. They should connected with some phenomena. So not necessarily a blood relatives. Even the industrial society, there is no blood relatives, but they have industrial values, boundings, binding factors, common characters, unique nature they have. Now we are going to see what is participation. Not necessarily take it single word participation. You can also take it along with the community participations. Community participation is a fundamental principles of community participation considered as a fundamental principles of primary healthcare. With this community participations brings widely reputed benefits, which include in health sector, which includes improved health outcomes, equity, service access, relevance, acceptability, and quality and responsiveness. So when you are encouraging community participations, this community participation ultimately bringing lot of benefits to the health, to improve the health. That when you are making community participation in primary healthcare, it brings widerly accepted benefits, which include positive health outcomes, equity in health, service access to all the communities, relevance to the service, and also acceptability among the community, then quality and responsiveness. These are all the perceived benefits already proved widely. So when you are encouraging community participation, these are all the expected benefits you are going to get it through your programs. So community participation can take place during any of the following activities. When you are encouraging community participations in different levels, different activities, you are going to do it in your community work. Community work commonly centered around, especially in health related community work. For example, you can do need assessment using community, then planning with the community, then mobilization, then training, then implementation, then monitoring and evaluation. These are all the common steps when you can expect community to participate, or you encourage community to participate in your programs. Need assessment, planning, mobilizations, training, implementation, monitoring and evaluation. Maybe you can say planning supposed to be done by the planners or expert. How the community is going to make planning? What is the level you are going to bring the community in your planning exercise? Well, this here you need to raise a question. who is going to ultimately, because of your program or because of your projects, who is going to benefit? If you are raising the questions, then you can get answer for the importance of bringing community into planning process. Because the community is the one who going to benefit ultimately. So you need to plan along with the community, where you are going to start your program, when you are going to start your program, how you are going to start your program, how it is going to make better when you are doing before something. So these kind of questions needs to be answered with this answer supposed to come from the community. So you need to include them even from need assessment, planning, mobilization, trainings, and implementation, and monitoring and evaluation. Now we are going to define what is community participation. Community participation is a political process. You should understand the word political process. Community participation is, you will see what is political process. Community participation is a political process in so far as community members acquire a say in decision making about health and healthcare issues that affect them, and a measure of control over the person that are supposed to serve their need. So community participation is a political process. When you say community participation, it is actually a political process, because you are bringing democratic process. When you are talking about community participations, this community participation bringing a democratic process. Each and everyone have the say, or they can able to participate in your programs. So community participation is a political process in so far as all the community members acquire to have a say. Those who are participating in your program, they should have a say. They should have a access. They can able to contribute in decision making process which affect them. So it's a political process which allow community to participate decision making process, the issues which affect them, and also they have a control over the process. They are politically, it's a political process which involve community members to have a say and also participate decision making, and also to control over the person who are carrying the programs. Though you are running the program, but if you are inviting community participations, you need to make all the members to have a say in decision making process, and also give control over the community. So you are the implementer, but they have the you should give a space to community to have a say in your program, and also to participate the political decision making process, and also to have a control over your programs. So I hope you understand what is community participation. It's a political process which allow community to participate and to say in your program, and also have the control over the program. So there are three words are very important in these definitions. It's a political process. They should participate decision making. They should also control over your programs, because ultimately whatever program you are implementing in terms of health, that is going to affect the community, that is going to make benefit to the community, either positively or negatively. So they should have a say in your program, and also to have a control over the programs. This definition given by WHO during 1984. So the community participations in legal terms, when you are speaking about community participations in legal terms, it is accepted by it. The following texts were given under Alma-Ata declarations. Zambia is one among the countries cite Alma-Ata declarations, which came into practice from 1983. So it means whatever we are going to say, it is going to be the official word. It applicable to a country like Zambia, those who are signatory. As of now, there are 192 countries who are signatory to Alma-Ata declaration. Primary healthcare is an essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology. The Alma-Ata declarations recognize the importance of primary healthcare, because the primary healthcare is essential to any healthcare mechanisms. So because the primary healthcare is a essential healthcare based on its practical and scientifically sound and socially acceptable method and technology. So primary healthcare, it is accepted because of the above mentioned components. Then the primary healthcare made available to all the individuals and families in the community. It is universally accessible to individual and families in the community. PHC is a universally acceptable concept. So it means almost 192 countries were accepted primary healthcare. So it is everywhere you go, you can able to get access to primary healthcare. Even I came from India, but I have what kind of treatment I access from my primary healthcare? Same kind of treatment supposed to be access within Zambian setup also, because it's a universally acceptable concept. This primary healthcare, it's supposed to be implemented through fullest participation of the community, through their full participation of the community, and it also at the cost of community and country can afford to maintain at every stage of their development. So the cost of the treatment or cost of the primary healthcare supposed to be acceptable, or it's the cost that community and country can afford to maintain at every stage of their development, in the spirit of self-reliance and self-determinations. So primary healthcare is an essential healthcare based on its sound, practical knowledge, practical and scientifically sound and socially acceptable method and technology, which made available universally to every individuals through their fullest participations, and at the cost of community and country can afford to maintain at every stage of their development, in the spirit of self-reliance and self-determinations. Whatever standard you are setting as a country under primary healthcare, it should follow universally accessible standard, which encourage fullest participation of the community and country to afford to maintain the same standard at every stage. It goes with the principles of self-reliance and self-determination. Sometimes the type of implementation may vary from country to country based on their affordability. For example, India, there is no health post. Indian setup, it starts with the primary health centers. The primary health centers run with the physician and the nurses and other support staffs. The auxiliary nurses, they're supposed to go into the community to get the patients to the primary health centers. But here the case is different. In Africa, there is a primary health centers which followed by health post. This health post were run by the nurses and other staffs. Primary health centers were with the physicians. So there is no big difference, but implementation mechanism is little different, because based on the self-reliance and self-determination of the country and the cost of the maintenance, this will define how to go. But the services were given under primary healthcare, it's supposed to be universally accessible one. So whatever the services like the basic healthcare facilities supposed to given to all the communities without discriminations. That's the ethos under Alma-Ata declarations. So especially we are going to see the key points under Alma-Ata declaration, which directly speaking about community participations. Declaration number 4, which talking about the people have the right and duty to participate individually and collectively in the planning and implementation of their healthcare. So people have right and duty to participate as an individual as well as collectively in the planning and implementation of the implementation process. Now you can able to refer with your definition, primary healthcare. So that translated into the declaration translated that into an action plan. So declaration number 4 clearly emphasize rights and duties of individuals, rights and duties of the community individually, collectively in planning and implementation of the healthcare mechanisms. Then declaration number 5, it emphasizes again, it's a essential healthcare service. It's a essential healthcare service based on its practical, scientifically sound, socially acceptable method and technology, made universally accessible to individual families in the community through their fullest participations, and at a cost of community and country can afford to maintain at every stage of their development in the spirit of self-reliance and self-regulation. Declaration number 8, primary healthcare, it requires and promote maximum community and self-reliance and participations in planning, organization, operations, and control of primary healthcare, making fullest use of local, national, and other available resources, and to this end, develop through appropriate education the ability of community to participate. It sounds covering everything. PHC requires and promote maximum community and self-reliance and participation in the planning, organization, operations, and control of primary health care, making fullest use of local, national, and other available resources, and to this end, develop through appropriate educations the ability of community to participate. Maybe you can form a committee, health committee, to looking after health planning, or you can invite community health workers to participate in your in implementation of your program, or you can say you can appoint the advisory committee from the community for your primary health centers, or you ask the community to take care of health posts. Different way you can do it. Now we are going to see types of participations. I told you different levels you can invite community to participate. So here we are going to see there are 8 types of community participations. Number 1, not exactly number 1, type 1, passive participations. Here people participate by being told what is going to happen or has already happening through unilateral announcement by administration. For example, passive participation means people just receiving information from their top authorities, or you already planned something, you already developed a program, you just tell the community, you already developed, even already started implementing. You just ask the community to say this program is going to bring these are all the benefits. You are not asked the community to participate all the process, but you are at certain level, you are just inform the community, these are all the way you are going to participate. You are just giving the information. You can say people participate by being told what is going to happen. Maybe the way the voluntary testing, it's not voluntary testing, mandatory HIV testing. If you are going to marry or if you are going to primary health centers, you're supposed to do HIV testing. That's what implemented from 2018. So people were told if you are going primary health centers, you're supposed to do mandatory HIV/AIDS testing. So here community consider it is enough to receive just the informations. So this is called passive participation. People participate, but they don't have any say in your planning process. They are just considered as beneficiaries. You are considering them as a beneficiaries. You are not allowing them to participate fullest level. You just consider beneficiaries. Then participations in information giving. Here people participate by answering the questions posted by extractive researchers using questionnaire survey or similar approaches and do not have the opportunity to influence proceedings. Here maybe you ask people certain questions. We have this program. We have this program. It's given by Ministry of Health. Ministry of Health. If you are willing, you can, because this problems is there in your community. So Ministry of Health is developing a program to implement this one. So you just participate by answering the following questions. For example, very recently, there was a survey conducted by Ministry of Health to assess HIV/AIDS prevalence status. There was a prevalence study done by Ministry of Health using, with the support of USAID. Just ask the questionnaires. Just ask the question to assess the prevalence level. Their community considered as a information givers. They don't have. They are not allowed to ask the questions about the surveys. Just orders come from Ministry of Health. The responsibility of the community to answer the questions. So you are giving information about what is coming from Ministry of Health. You are asking them to answer. So there is a slight difference between passive participations and participation in information giving. Passive participation, you are just consider them as a beneficiaries. Here, you are just consider them as a respondent. That's all. Then participation by consultation. People participate by being consulted, and external people listen to views and may modify this in the light of people's response, but do not involve them in decision making. Here, you have something, you have already developed a program or a project, but what you are doing here, you are inviting the respondents or inviting the community to participate in your programs. The way you organize the consultations, you are engage your community, then you are explaining your projects, then ask the response from the community, ask the response and views from the community. This process is going to be done by the external persons. So they are receiving the different views from the community, then they make necessary changes if it is needed. Here also, you are just ask the people to give their comments. You pick the comments which you feel necessary, not by the people. People where feel it is necessary, but you are not take them everything. You feel if it is necessary, you are take them and make changes in your projects. It means you are not allowing people to participate. You are not allowing people to participate in decision-making process. The fourth one, participation for material incentives. Here, people participate by providing resources. For example, labor, in return for food or cash or other material incentives. Yet, people have no stake in prolonging activities when the incentives end. For example, you are digging a water well, or you are digging a farm bund, or you are digging a community farm bund or community well. Maybe you have resources from Ministry of Community Development. For example, you are having 100,000 kwacha for digging a well. You don't want to engage a borehole, your company. Instead of going with that, you wanted to dig a open well. So you are asked the community, though whoever is coming to do your manual work, you are going to get salaries in the form of food subsidies, or in the form of cash, or in the form of other material incentives. Those who are working here, you are going to get this benefit for the sake of community engagements. So the community is doing their manual work, getting their salaries, or getting their food subsidies, or getting their material incentives. But ultimately, community is also going to benefit individually as a cash or other material incentives, and also community is going to dig a open well. Here you are engaging different level with the community. You are engaging community for doing something and also giving resources to the community to develop certain community infrastructures. But here still people have no stake in your process. You are just take them as a your level of participation is increased, but still they are not having any say in your process, because once the incentives is over, their participation is also going to over. So up to the level of incentives, you are allowing community to participate. Then fifth one, functional participation. People here participate by forming groups to meet predetermined objectives related to the projects after major decisions have been done. For example, a big project's coming, that projects it's necessary to form different groups. For example, the FSP, food security pack. This food security pack, it have different components. It have different components. So each component you are setting a different group, subgroups. So people will participate different subgroups with the different determined objectives. Objectives were set by the bigger projects, but each objectives you are setting different subgroups. So subgroups, they are meet and determine their objectives, which supposed to contribute to the major decisions. Here you are allowing them to participate to decide certain affairs, not the entire thing. You are allowing them to participate certain affairs. So the group which they involve, they are setting their own objectives for implementation. It is not everything, but at least certain level they are allowed to set their objectives based on the major decisions. Seventh one, interactive participation. People participate in joint analysis, development of action plans, and formations and strengthening of local institutions. Here, you have a program. You are set the people. This much money we are having. 1,000 pocha, 100,000 pocha we are having. This money is supposed to be used for this purpose. Maybe setting up a primary health centers, or setting up a hand washing program, something like that. See, program is this, resources is this, but you can decide which program you want to do it, which you can do analysis jointly with community and develop action plans and formation and strengthening of your local institutions. So you are saying you are decided a program with the resources, then you ask the community how you are going to implement this program through joint analysis, development of action plans, and formation and strengthening of your local institutions. It is going interactive participation. It is going a certain high level of participation by the community, because you are allowing community to jointly do analysis, preparing action plan, and also formation and strengthening of their local institutions. Eighth one, self-mobilization. Here, people participate by taking initiative independent of external institutions to change the system. Self-mobilization, it is about people themselves taking initiative. It's a self-initiative. Maybe they felt this is our problem. For example, we don't have a drinking water facilities. We don't have a drinking water facilities for our hamlet. So community sit together and find out this is our biggest problem, because many people are suffering because of this issue. So we need to take a certain initiative. So people were participate themselves, taking initiative independently from the external institutions to change, wanted to change their systems. They develop contacts. They come up with a proposal to install something, come up with a proposal to do something. So they develop a proposal and ask the donors to participate. Here, everything done by community, then ask the contact with the external institutions or resource people or technical advisor to support their proposals. So here, they develop contacts, they develop a proposal, contact with the external institution for resource mobilization and technical advice if they need. But retaining control over how the resources are used, it is going to be with the community. So I hope you understand the different levels. Passive participations, participation by information giving, participation by consultations, participation for material incentives, functional participations, interactive participations, self-mobilizations. So you can, the ladder goes from passive information giving, so it is going further. It reaches self-mobilizations. Self-mobilization, it is not going to easy task. If you work with a community at least minimum of 5 years, then only you can able to reach the level of self-mobilization. So now we are moving to the principles of community participations. Before going to see the principles, you need to understand the values, because principles and values are one another. It work together. So values of community participations, you should understand the values of community participations. You should accept people have right to participate in the decision that affects their lives. You should understand people have right to participate in the decisions that affects their lives. Then you should consider the beneficiaries of public policies can add value to its development and its implementations. Though they are the beneficiaries of public policy, but they can able to add value to your programs. So they have rights to participate in decision-making process, and also though they are beneficiaries, but they can able to bring add value to your programs. Then the third one, benefits of participation must be shared equally. Whatever benefits your projects brings, that should be shared equally without any discriminations. This participation should build trust through cooperative strategies of problem solving and discussion. So these are all the values you need to keep in your programs when you are encouraging community participations. Then the principles of any successful community participation programs. The scope of the activities at each level, the CPP is authorized to consider must be clear. So you need, when you're setting a program, you need to authorize the community participation should be at each level. You should create a scope for each level. Community participation must be developed. Then chain of authority flowing from neighborhood to community must be clear. You need to set chain of authority. Whom supposed to be meet next level, next level, next level. It's supposed to be clearly spelled out. Then you need to maintain transparency, honesty, and clarity about the purpose, the limits of what can be, what can do, what cannot be do. Who can involve, how they are going to be involved, what happened in the end result. Then you need to allocate adequate resources to manage the process well and deliver the results. Then you need to invite appropriate participants, representative or inclusive with the traditionally excluded groups, giving special support and encouragement for their involvement. You need to allocate adequate resources to manage the process well and to deliver the results. Then it's necessary. The final point I emphasized here, accessibility to all the participants especially excluded community, should be encouraged. You need to create accountability. Then you need to set planning and development. Then you need to give power to the CPP process. I hope you understand the importance of community participations. Importance of community participations in terms of health. I believe you understood the meaning of community participations, community and community participations. You can able to describe the responsibility of community in healthcare system. I believe you are able to list out the levels of participations clearly. Then you can able to describe the community involvement in health delivery system. Once again, I thank you. I'll meet you with the next lessons, unit number 11. Thank you. Bye. Have a nice day.